Hello, and welcome to Cancer TV News. I'm Heather Algetz, your host for the program. During this episode, we'll review the association between radon and lung cancer, chemotherapy's effect on brain function, and why certain groups are less likely to have colon cancer screenings. A study published in the journal Health Physics reports that low levels of radon, typically found in homes in the United States, do not increase the risk of lung cancer. This is in contrast to what has been widely believed. In fact, at low levels, radon may even reduce the risk of lung cancer. A study was performed using 200 patients with lung cancer and 397 individuals without cancer. All participants had lived in a radon-testable residence for at least 10 years. Subjects were categorized into one of 9 smoking categories based upon how long and how much they had smoked. Radon levels were determined with detectors that were placed in multiple locations throughout the homes. The findings suggested a hormetic effect, suggesting benefits with exposure to a toxin at low doses. According to the 2 studies presented at the American Academy of Neurology, chemotherapy does not cause what is commonly called chemofog. Chemofog is impairments in the memory and thinking that have been attributed to chemotherapy. The first study was performed on 30 women with breast cancer and 30 women without cancer. The researchers from Australia used a test to evaluate the changes in cognitive function before each cycle of chemotherapy was administered and also 28 days after the last cycle. They found that learning ability and cognitive performance were significantly impaired even before chemotherapy was started. 3 women developed cognitive impairment over the course of chemotherapy. However, the results of the impartial assessment did not match the women's personal reports. The researchers concluded that chemotherapy-related cognitive impairment was infrequent and isn't linked with the women's individual cognitive issues. A group of scientists from Michigan State University reported similar findings for 17 women with newly diagnosed breast cancer, 20 women who had completed chemotherapy for breast cancer, and 21 women who were diagnosed with benign disease. The investigators found that newly diagnosed women with breast cancer were significantly less accurate on memory tests than the women who had completed their treatment. They also found that newly diagnosed women scored marginally worse than women diagnosed with benign diseases. The investigators concluded that the cognitive difficulties experienced by women with a new breast cancer diagnosis may be related to a stress as a result of the diagnosis and other quality of life factors. Swedish researchers reported that men, unmarried adults, and those with low incomes are less likely to accept an offer of a free colon cancer screening. Researchers reported that nearly 2,000 adults, ages 59 to 61, men were 27% more likely than women to decline free sigmoidoscopy. Sigmoidoscopy is one of the routine tests used for colon cancer screening. The investigators also found that single people were 69% and divorced people were 49% more likely to decline screening. Similarly, they found that 1/3 of participants with the lowest incomes were 68% more likely to decline a sigmoidoscopy. While the study did not look at why these groups were less likely to accept a free colon screening test, the researchers speculate on some potential reasons. Lower income adults may have trouble taking the day off of work, arranging transportation, and may be less aware of the consequences of colorectal cancer and the benefits of screening. Men tend to have less overall health knowledge than women and are less likely to take preventative measures. Studies suggest that married people are more proactive about their health than single adults are, possibly because of their spouse's encouragement. That's all for this episode of Cancer TV News. Join us again next time.